tell us a little bit more about the community fund, the COVID-19 community fund that you guys initiated?
Yes, so we initiated this fund several weeks ago, and that is at UWNYC.org. And if you go onto the fund, you can see very clearly that we are investing in food insecurity and education and dealing with all of the frontline issues here in New York City. And you'll also see some of the outcomes of what we've been able to do so far. We have an application open for community-based organizations to apply to also receive funds. And we've been overwhelmed with requests, really worthy requests. There's a lot of need. And I think people don't appreciate that it's the small community-based organizations that people trust. They've been doing tremendous work, and they're also challenged, and we need them to be strong institutions so they can meet the needs and demands of the community. So we're certainly encouraging people to go and donate, because it's going to go a long way.
And you've also been doing a lot of work around the SNAP program as well, right?
Mm-hmm. Absolutely.
What's that work entail?
Yeah, the SNAP is the Supplemental Nutrition Assistance Program. But for people who are my age, they're the food stamps. And listen, my family was on food stamps. I am not ashamed. My mom was a single mom. She had me and my older sister by the time she was 17 years old. And, she worked about 3 jobs and a half, 3 pieces of jobs. And she needed money to put me on the table to make sure that we had enough to eat. And she is one who went without to make sure that we had what we needed. And so when I think about, the work of United Way, that's what we're doing. We're trying to fill in the gaps for families like mine so that we can all reach our promise and potential, and really support people like my mom and a lot of other people's moms along the way. But food stamps are a federal program, and there's another thing people can do in terms of your assignment: advocate. We need you to write to Congress, state, city elected officials. We need you to say, these are our tax dollars. We're paying. They've taken our money. This is how we want you to invest it. So SNAP is a federal benefit that enables you to buy food. Now there are millions of more people who are eligible for SNAP. And so one of the things that we're doing is we are making sure that there's enough outreach to inform people. A lot of people don't realize that they're eligible for this benefit. They think they make enough money, but you probably don't. Or they might feel like uncomfortable or ashamed, and you shouldn't. You pay taxes.
Yes.
You pay sales tax, you pay income tax. It's your money. And you should avail yourself of this benefit when you need it. Because as you said, doctor, if you're not eating and you're not healthy, you're going to be more at risk.
You are.
And the United Way has been advocating for a 15% increase?
Absolutely. There's something that the federal government can kind of flip the switch on, is, a pandemic SNAP, which this is a pandemic. And so, and we need more resources. We need to also make sure that those resources are not limited inappropriately, because there's been some very inappropriate limitations for the immigrant community, which is, outrageous. There were those limitations weren't there before.
Right.
And so we need to advocate against that as well. Your immigration status should not have anything to do with your access to SNAP benefits. It was not like that before, and it certainly shouldn't be like that now.
And that's a critical one, because there are also families where they have mixed immigration status. And so the kids themselves are U.S. citizens, for example, but the parents are afraid, and thus they're all starving as a result. Absolutely. So for the person who's listening who wants to help with that advocacy, are there like form letters or templates on your website that they can use to help get them going if they're worried they won't know what to write?
Absolutely. There'll be templates and information, but also, using social media to really spread the awareness. Everybody here, on Instagram has power.
Yeah.
Through social media tools. And so, squeaky wheel gets the grease. We've got to beat the drum and not let people get away with not doing the right thing. And so that is certainly something each one of us can do, who live here, who's resident of the United States of America, and that's something that we should be doing.
Wow. Now, for someone who's listening, who's trying to figure out how much they should donate if they have access, can you help give some guide points? For example, how much does it take to feed a family of 4 in New York? If someone wanted to make a donation that feeds a family, what numbers are we looking at?
So, and I don't know if I have them like right in front of me, and I might be a little off, but essentially, the way we calculate the cost of a meal, it's about $2 a meal for for $2 a meal for a person. And so for a family of 4, if you're feeding them at one sitting, that's about $8, which is not it's not a lot for many people, but it goes a long way. And because of our ability to we buy the food in bulk, so it's lower cost, and we distribute it through this whole network of providers. That's not a lot of money, and it can go a significantly long way. Another touch point, just in terms of dollars, is about $25 will help build a home library for a low-income family and get about 12 books in the home. And all the research and studies show that if you have 25 books in your home, there's a connection to your reading proficiency, direct research base. Imagine going from 0 to 25 books. If you can, $50, get people the books that they need, and every 10 books also helps drive proficiency. Because that's the other thing that's devastating to me, is that the first things that are being cut are educational. Education, some are, programming, educational opportunities for low-income families and children. This is our future.
Yes.
It's like we're cutting that off in the worst of times, and it's only going to make things worse as we move forward.
Correct.
There's going to be another COVID or something down the road, and we need our communities to be well educated and activated and resourced to solve the problems of tomorrow.
Absolutely.
Yeah. It's an opportunity to start building the infrastructure for more things to come.
Absolutely.
We're heading into the fall and flu season, and there's a potential, next spike that can happen with this virus. So if we start putting in place the infrastructure now, it can do a lot of good in the future.
Absolutely. And we cannot wait. I feel like we can feel, because it's just can be just overwhelming every day. Particularly living in New York, you hear sirens all day. We celebrate when the death toll is only 300 people died today. And it can be very wearying, but as you said, Winston, we have to be organized and planning and executing now, because we just have to.
We have to just reiterate, a lot of the frontline workers that are making it possible for us to stay home, making it possible for us to get treatment at the hospital, are people of color.
Yes.
Are of our community,
Overwhelmingly. And it's not just, the nurses and certainly doctors, it's the people who are cleaning the rooms.
Yes.
It's the people who are the security at the hospitals. It's the people who are, that's all of us. And
yes.
And I think about, firemen are like, heroes, and because they're running into burning buildings. These professionals are literally running into danger every single day and then putting their families in danger.
Indeed.
Which is but every day for multiple days with no end in sight.
The MTA workers as well.
Absolutely. They've experienced the most deaths of any municipal body. And
it's just shocking.
Devastating.
And those are for anyone who's not from New York, the MTA are the bus drivers, the train conductors, the servicemen and servicewomen, cleaners, anyone who works for that body are those workers. And they're predominantly people of color, predominantly working class people who also can't stay home.
Yeah. I mean, you need them to run the city, but they're also working so they can provide for their families. It's a double-edged sword.
And the major health concern as well is that after these people recover, if the ones who don't die, the ones who recover are now going to be permanently disabled because there are a lot of, like long-standing effects of the COVID-19 virus on the lungs and so on. So helping to build some infrastructure about how to take care of these people after they recover is also a major thing.
It's true. Getting them to rehab, getting them to care. What most of you may not know is currently rehab facilities and nursing homes are not accepting people who tested positive for COVID. So if they were in hospital, many of them need to go home right after having been intubated and needing help to breathe, which means they need help at home. They need not just food, but they need assistance. They need, if they were previously working, they need help paying that rent going forward while they recover to the best that they can. But Winston makes a very big point here because there's a huge disability wave that's coming. And when you couple that with communities that were already vulnerable, we're looking at a major hit in communities that were already struggling to come out of poverty.
Absolutely. And another thing there is the mental health issues, right, as a result of this. And we have been investing in trauma services for families as well, but that is going to be significant for many people.
Yes. And tell us a little bit more about 211. How does 211 work? And for those who are listening who might also be saying, I think I need this help that Sheena is talking about. How do I get help from Sheena? What can they do?
Well, if you live in New York City, you should dial 311, and that is the city service. Well, it's a call center, and that helps connect to resources. Outside of New York City, the number is 211, and that is managed by a network of United Ways across the country. And it is a referral service, an information service. Both of them will help connect you to what you might need and can answer questions. Here in New York City, they've actually had to significantly increase the capacity of 311 because the numbers, I think, quintupled. And so they're hiring hundreds of new operators because, that example that you gave, those examples you were giving of people who are so many people have contracted the virus and are sick and have these lingering issues and need to know where to go for help. Yes.
And I think that cannot be lost, guys. So when we're raising funds, not only are we raising funds for the vulnerable in terms of those impacted by the layoffs and school closures and everything else that comes with life in general and the high cost of living in New York City, but we have to couple that with the after effects of a COVID-19 infection and the long-standing after effects in families. Just because we see the numbers that say people are recovered, it doesn't mean their lives have recovered, and we need to help them in that regard.
Absolutely. So many lives are changed forever from this pandemic. Obviously it's like nothing we've ever seen, and you're absolutely right. This is not just for this moment. The effects of this are going to be with us for the years to come.
It's true. And there's so many families who were on the verge of possibly climbing out of poverty, where now this disease has plunged them back and even deeper into poverty. And we need to be aware of that. And we need to try to see how we can pull them back up.
Yeah.
The whole goal here is not just to rescue, but to recover as best we can.